This is Professor Capron. Let's look at the importance of incorporating theories of growth and development in nursing care. By the end of this presentation, you will be able to understand the importance of evaluating growth and development in nursing care, learn how to assess and plan holistic patient-centered care, and apply multiple developmental theories in nursing interventions. Please pause the video and take some time to make sure you understand these key terms and their definitions. Understanding the growth and development of individuals is critical in providing holistic nursing care. Let's look at why it's important to evaluate various aspects of development and what components you need to be considering. Evaluating growth and development is essential because it helps in understanding the overall health and needs of a person. Each aspect of development, physical, cognitive, psychosocial, and moral, interacts to shape the individual's overall well-being. For example, a delay in physical development might impact cognitive abilities and psychosocial interactions, while moral development can influence a person's decisions and behaviors. Different stages of growth and development come with unique challenges and concerns. Remember from other presentations that adolescents may struggle with identity formation, Erikson's stage of identity versus role confusion, while older adults may deal with issues of integrity and despair, Erikson's stage of ego integrity versus despair. Understanding these stages helps in addressing the specific needs and providing appropriate support. Physical growth includes changes in body size, proportions, and the development of motor skills. Nurses must monitor growth patterns such as height and weight to ensure that individuals are developing appropriately. Deviations from the norm can indicate health issues that need to be addressed. Cognitive development involves the progression of skills like thinking, learning, and problem solving. Theories like Piaget's cognitive development theory highlight stages such as the sensory motor stage in infants, where learning is through sensory experiences and actions, to the formal operational stage in adolescence, where abstract thinking becomes possible. Recognizing where an individual is in their cognitive development aids in providing appropriate educational interventions and support. Emotional and social development refers to the ability to experience, express, and manage emotions, and to form secure interpersonal relationships. Erikson's stages of psychosocial development emphasize the importance of social interactions in shaping personality. For example, the trust versus mistrust stage in infancy is crucial for developing a sense of security. Understanding these stages helps in fostering supportive environments that promote healthy emotional and social growth. Moral development is the understanding of right and wrong, while spiritual development encompasses a person's beliefs and values. Kohlberg's moral development theory outlines stages such as pre-conventional, conventional, and post-conventional levels of moral reasoning, while Fowler's faith development theory describes stages from intuitive projective faith in early childhood to universalizing faith in adulthood. Evaluating these aspects helps in supporting individuals' moral and spiritual needs and contributes to holistic care. Evaluating growth and development across these components ensures comprehensive care that addresses all facets of a person's health and well-being. By understanding the stages and components of development, healthcare providers can tailor their interventions to meet the unique needs of each individual, promoting optimal health outcomes. To deliver truly patient-centered care, it's essential to start with a thorough individual assessment. This involves understanding the unique needs, backgrounds, and ages of each patient. Every individual brings their own set of life experiences, cultural backgrounds, and personal preferences that can significantly impact their health and healthcare needs. By recognizing these factors, we can ensure that care is tailored specifically to each person, fostering a more effective and compassionate approach. For example, a young adult will have different concerns and coping mechanisms compared to your elderly patients. Similarly, cultural differences can influence how patients perceive illness and treatment options. Recognizing these differences, creating a care plan that respects and aligns with the patient's values and expectations. Tailoring care plans means moving away from a one-size-fits-all approach and instead crafting care strategies that address the specific needs of each patient. This involves considering their physical, emotional, social, and spiritual needs. For instance, when dealing with a patient from a different cultural background, it's important to consider their dietary preferences, language needs, and health beliefs in the care plan. Additionally, age-specific considerations such as developmental stages in children or cognitive changes in the elderly must be integrated into care planning. Personalized care plans not only improve patient outcomes, but also enhance patient satisfaction and engagement in their own care process. A holistic, patient centered approach requires integrating all aspects of a person's well being: physical, emotional, social, and spiritual. Physical care involves addressing the immediate medical needs and managing chronic conditions effectively. Emotional care focuses on mental health, stress management, and supporting the psychological well being of patients. Social aspects include considering the patient's family dynamics, social support systems, and community resources. For example, providing a space for prayer or meditation for a patient who values these practices can significantly enhance their comfort and trust in the care they receive. By addressing these multifaceted needs, we can promote overall wellness and improve the quality of life for our patients. Effective collaboration with patients and their families is a cornerstone of holistic patient centered care. This means actively involving them in the decision making process and ensuring their voices are heard and respected. Open and honest communication is vital. Educate patients and families about the patient's condition, treatment options, and care plans. Encourage questions and provide clear, understandable answers. This collaboration helps to build trust and ensures that care plans are realistic and aligned with the patient's goals and preferences. For example, involving family members in care discussions can provide valuable insights into the patient's lifestyle, preferences, and support systems, which can be critical for successful care planning and implementation. Incorporating a holistic, patient centered approach in nursing practice is essential for providing high quality. When we approach patient care, it's crucial to draw from multiple developmental theories. Each theory offers unique insights into different aspects of human growth and behavior. By understanding these frameworks, we can better assess our patients' needs and provide more comprehensive care. For instance, Freud's focus on early childhood experiences can help us to understand the root causes of certain adult behaviors, while Erikson's stages of psychosocial development highlight the ongoing challenges individuals face at different life stages. Using multiple theories allows us to implement evidence-based interventions. This approach ensures our care strategies are grounded in well-researched concepts, enhancing their effectiveness. For example, understanding Piaget's stages of cognitive development can guide how we communicate with patients of different ages, ensuring that our instructions and education are age appropriate and easily understood. Similarly, Kohlberg's stages of moral development can inform our approach to ethical discussions and decisions with patients and their families. Freud's theory emphasizes the influence of early childhood experiences and the unconscious mind on behavior. Understanding Freud's stages, such as the oral, anal, and phallic stages, can help us to recognize the origins of certain behavioral patterns and psychological issues. For example, a patient with a strong need for control may be reflecting issues from the anal stage of development. This insight can guide our therapeutic approaches and patient interactions. Erikson's theory focuses on the social and cultural influences on development across the lifespan. Each stage, from trust versus mistrust in infancy to ego, integrity versus despair in older adulthood, presents unique challenges and opportunities for growth. Recognizing where a patient is in Erikson's stages can help us tailor our care to support their psychosocial needs. For example, providing opportunities for young adults to form intimate relationships can support their progression through the intimacy versus isolation stage. Piaget's theory outlines how children acquire knowledge and learn through stages: sensory motor, pre-operational, concrete operational, and formal operational. Understanding these stages helps us to communicate effectively with patients of different ages. For instance, using concrete hands-on teaching methods with school-aged children in the concrete operational stage can enhance their understanding and retention of health information. Kohlberg's theory focuses on moral reasoning and its development through the levels of pre-conventional, conventional, and post-conventional. Recognizing a patient's level of moral development can guide our approach to ethical discussions and support. For example, helping a patient in the conventional level understand the importance of adhering to societal rules and expectations can facilitate their treatment plans and health advice. Using multiple developmental theories in nursing practice allows us to provide holistic, patient centered care that addresses the physical, cognitive, psychosocial, and moral dimensions of our patients' lives. This comprehensive approach ensures we meet their diverse needs effectively, enhancing their overall well being and health outcomes. Let's look at comprehensive health promotion and how it might be impacted by our understanding of developmental theories. Preventive care and early detection emphasizes the importance of regular screenings and checkups to catch diseases early. Preventive measures can significantly reduce the incidence and severity of chronic diseases. Early detection allows for timely interventions, improving patient prognosis and quality of life. Patient education and empowerment educates patients about their health conditions and treatment options to foster autonomy. Empowered patients are more likely to engage in their care and make informed decisions. Education should be tailored to the patient's level of understanding and cultural context. Encouraging healthy lifestyle changes, such as diet and exercise, can prevent or manage chronic diseases. Providing support and resources for these changes increases the likelihood of success. Continuous support from healthcare providers is essential to maintain these modifications. Let's look at some examples in practice. How about nutritional counseling? Tailored advice on diet can prevent malnutrition and manage conditions like diabetes and hypertension. Understanding cultural food preferences and dietary restrictions is important for effective counseling. Stress management techniques are important because stress can exacerbate many health conditions, so teaching patients coping mechanisms is beneficial. Techniques can include mindfulness, relaxation exercises, and behavioral therapy, but needs to be tailored to the patient's developmental level. Chronic disease management involves the ongoing management of chronic diseases and requires a comprehensive approach. This includes medication adherence, regular monitoring, lifestyle changes, and patient education. Effective management can prevent complications and improve the patient's quality of life. By understanding and integrating these developmental theories and health promotion strategies, healthcare providers can offer more comprehensive, personalized, and effective care to their patients. This holistic approach not only addresses the physical health needs, also considers the emotional, social, and spiritual aspects, leading to better patient outcomes and satisfaction. It's essential to consistently monitor the progress of children and adults in reaching expected developmental milestones. These milestones include physical abilities, cognitive skills, social interactions, and emotional regulation. For infants and young children, milestones such as sitting up, walking, talking, and playing with others are critical markers of development. In adults, milestones might focus more on psychosocial achievements and cognitive functions. Regular monitoring helps in identifying if a patient is progressing normally or if there are any deviations that might indicate underlying issues. By tracking these milestones, healthcare providers can spot early signs of developmental disorders. Early identification allows for prompt intervention, which can significantly improve outcomes. For example, if a child is not speaking by the expected age, it might indicate a hearing issue. It could be autism spectrum disorder, or it could be other developmental challenges. Early intervention can provide the child with the support needed to develop communication skills. In adults, monitoring cognitive decline can help in early detection of conditions such as dementia or Alzheimer's disease, leading to early management strategies. Individualized care plans should be tailored based on the developmental stage and specific needs identified during assessments. This ensures that the interventions and support provided are relevant and effective. For children, this might mean incorporating speech therapy, physical therapy, or special education services into their care plan. For adults, it could involve cognitive exercises, social support groups, or mental health counseling. Customizing care plans helps in addressing the unique challenges and promoting optimal development and well-being for each individual. Effective developmental assessment and intervention often requires the collaboration of a multidisciplinary team, including pediatricians, nurses, physical therapists, occupational therapists, speech language pathologists, and psychologists. For example, a child with developmental delays may need a comprehensive approach involving various specialists to address all aspects of their growth and development. Similarly, an elderly patient with cognitive decline might benefit from a team that includes a neurologist, geriatrician, and social worker. Collaboration ensures a holistic approach to care, considering all aspects of the patient's development and providing coordinated support across different areas. As we conclude our discussion on the importance of incorporating theories of growth and development in nursing care, let's look at key points. Understanding and evaluating growth and development is crucial in providing comprehensive nursing care. This involves recognizing the physical, cognitive, psychosocial, and moral development stages of patients across their lifespan. Evaluating these aspects helps to identify normal developmental milestones and potential delays or issues that may require intervention. By doing so, we can ensure that care plans are tailored to meet the specific needs of each patient, ultimately promoting better health outcomes. Evaluating growth and development allows for early detection of developmental delays or abnormalities, which can be crucial for timely interventions. It also helps in understanding the patient's overall health and well-being beyond just their physical symptoms. Adopting a holistic, patient-centered approach means recognizing and addressing the diverse needs, backgrounds, ages, and stages of patients. This approach involves tailoring care plans to fit individual patients and integrating physical, emotional, social, and spiritual aspects into the care process. Collaboration with patients and their families is essential to ensure that care is comprehensive and aligned with their values and preferences. A holistic approach respects the uniqueness of each patient and provides care that is not only medically effective, but also supportive of their overall well being. This leads to more effective patient engagement, satisfaction, and adherence to care plans. Utilizing insights from various developmental theories allows for a well rounded understanding of patient development. Theories such as Freud's psychoanalytic theory, Erikson's psychosocial development, Piaget's cognitive development, and Kohlberg's moral development offer different perspectives and tools for assessing and supporting patients at different life stages. By integrating these theories into nursing practice, we can provide evidence based interventions that are tailored to the developmental needs of our patients. So, in summary, evaluating growth and development is essential in nursing care to ensure that we meet the comprehensive needs of our patients. A holistic, patient centered approach that incorporates multiple developmental theories can enhance our ability to provide personalized, effective care. Thank you for your attention. I hope this presentation has deepened your understanding of the importance of developmental assessments in nursing practice.